So admit it, this is the bit you've really been waiting for. This comes up a lot in the clinic, probably sort of 3 groups of symptoms that come up a lot. So no libido, or no libido for sex, definitely. So just no interest, can't be bothered, rather read a book, have a bath, or, watch Netflix. Sorry, Peter. And difficulty becoming aroused, difficulty having an orgasm, and sex actually feeling painful. And all of these symptoms fall into something that's being called genitourinary symptoms of menopause. And basically we have genital symptoms, sexual symptoms, and urinary symptoms. And all of them, to be honest, can be quite problematic. And it's definitely something that what I love is that more and more women are getting much braver and being able to talk about it. What I do find is, though, there's definitely a lot of women who are extremely concerned about their relationship. They're very, very worried that their partner is going to leave them because this is a big, big problem. And obviously we can't blame hormones on everything. Maybe your partner's crap. Maybe he's not very nice to you. So, there can be lots of other things going on. If you're on antidepressants, that definitely really can make your libido extremely low. So I think we have to, again, not blame everything on perimenopause and menopause, but there's absolutely no doubt. As a GP, I obviously do cervical screening, or used to be called a pap smear, on a regular basis. And what I can tell you is that I can tell by looking if someone is perimenopausal or postmenopausal, because there are really obvious differences that you can actually see. So a lot of the changes aren't your imagination. There are physical changes. So, for example, the vulva or the labia on the outside start to look paler and smaller. And people will say that their clitoris is disappearing, and again, it's not their imagination. And whenever we go to do like the cervical screening test, for a lot of women, it's very uncomfortable. And whenever I put my little speculum and my little light in there to have a look, it looks like there's little pinpoint bruises, and often it looks really quite red and sore. And I'll have women tell me that actually having sex can feel like someone is burning them, or it feels like rough, like sandpaper, and they'll often just have to ask their partner to stop because the symptoms can be so challenging. And I often find that it can be like a desert, literally. And I often find that even before people are having a cervical screening, I will often send them off to go and take vaginal estrogen for 4 to 6 weeks so that I can actually do that procedure in a really kind way, because quite frankly, it's awful for someone to have a procedure which is preventative and which is screening and which is an absolutely horrendous experience for them. In your goodie bag that you've got, which is pretty heavy and full of lots of nice things, we have put a thing called Replens in there. We obviously can't put anything that's prescription in there, but we have put Replens in there. And I want to describe Replens. It's a vaginal moisturizer. It comes basically with a little thing, and you squelch it up inside and you hear this noise as this stuff sticks onto the walls of your vagina. It lasts for about 3 to 4 days, and whether you're sexually active or not, so many women will tell me that it's quite a life-changing product because it actually makes them feel more comfortable. I even have women who will tell me that they no longer can wear like tights or jeans or even a swimsuit because they're so uncomfortable in this area. Another product that's really, really helpful, which has been talked about a few times, is vaginal estrogen. And I can't overestimate really how important it is. Probably every woman, I should say, should be on vaginal estrogen. This is what it looks like. It comes with a little applicator, and it literally is like a Tic Tac. I don't know how else to describe it. I mean, not that I put Tic Tacs in my vagina, but that's what this is like. the one thing I will say is if you do get prescribed this by your doctor, and I think that most of you should, if you have if you want to protect both your vagina and your urethra, which is the tube that brings your wee from your bladder out, and if you want to stop having UTIs and you want to stop having cystitis, especially after you have sex, then you want to start putting some estrogen back into your vagina. And my one tip would be that I see patients sometimes will come in and ask me to show them what to do, and they're ramming this thing right up, like literally it's like nearly at their throat. You don't need to put it in that far. You actually only need to put it in a little bit, because actually for most people a lot of the worst symptoms are actually just inside the vagina. So you really only want to be probably popping that in maybe about 1 to 2 inches, and then clicking that little tablet in to the vagina. You can also use a cream. In the UK and Northern Ireland, they're really lucky. They have these little rings that you can put in that release estrogen, so you don't have to use it all the time. But we haven't managed to get that here yet. The cream is probably a little bit more messy, but the really nice thing about using the cream is that you can actually rub it on the outside as well. And some women find that really helpful. All joking aside, the reality is that this area does suffer from decreased blood flow. So obviously men get their Viagra whenever they have this decreased blood flow, but there hasn't actually really been anything for women. And so, you know, some of the things that I'll get my patients to use, to be honest, are a vibrator, because that basically is going to increase blood flow to that area. And the other thing is that if you're having sex and it is very painful and you're using your vaginal estrogen and you're using your replens and it's still really uncomfortable, then the reality is that your brain has now set up a bit of a pathway where your brain is quite scared of sex. Because our brains are very smart, and from an evolutionary purpose, if we have something that's really painful, our brain remembers it and goes, actually, I don't know that I want to do that anymore. I mean, maybe apart from childbirth, where we seem to forget that one. But really, you get this pathway set up, and you get this contraction of the muscles just inside the vagina. People get really tense. It's like bracing themselves, knowing that this is going to really hurt. So one of the other tips that I do with a lot of my patients is I do recommend that they buy themselves some vaginal dilators. And the only way I can describe vaginal dilators is a bit like Russian dolls, except they're like little mini penises, basically, of different size. And they start very small, like the size of your finger or your little finger, and they work their way up. And basically what you need to do is kind of retrain your brain. So once you've got that vagina with more estrogen in it, and you've got some lubrication in there, then I recommend initially on your own, you get yourself some confidence back, and you gradually increase the size of the dilator so that it eventually feels comfortable, and that you feel then you can potentially have sex again. Because the reality is, I'm not going to ask for a show of hands, but the reality is I have a very high proportion of women who are coming in to see me who are saying they haven't had sex for 2, 3, 4, 5 or more years. And this is people who do have a partner, but they actually cannot physically have sex because it's so uncomfortable. So I think it is definitely something that you don't need to suffer in silence. If you find it really hard to bring up, maybe the next time you see your GP, it's worth mentioning whenever you go to have your cervical screening test. It's just a really good opportunity to say, look, I'd really like to think about some vaginal estrogen because it makes such a difference. Kerry talked a little bit about the urinary symptoms of menopause. And the reality is that lots of women tell me that they're getting up and down multiple times at night because they need to go to the toilet so often, or they have to plan every car journey knowing where all the toilets are along the way. And it's not just a case of, oh, well, if I don't know where there's a toilet, I can hang on. It's, if I don't get to a toilet, I need a full change of clothing, because that's how disastrous their bladder and urethra is. And what we know is that there's lots of things going on there. There is obviously, perhaps we've had babies or big babies. The sling that supports our pelvis is not as good, but remove estrogen from the mix and you make it a whole lot worse. And as Karen very well demonstrated with her wine box, we often forget about our pelvic floor. We might half-heartedly do those exercises for 3 days after you have a baby or whatever, and then you forget because it's too boring. But the reality is that we need to do that, or else these urinary symptoms are going to get worse. And the other thing is that, unfortunately, death from urinary tract infections is one of the commonest causes of death in older women. Like, it's a real thing, and it's massive. And so you don't want to just spend your life on antibiotics for UTIs, which I see a huge number of my elderly women doing. Pardon me. The other thing I would just say is sometimes psychology is required if someone has really developed this pain pattern where they're really, really frightened of sex. Then sometimes we need to do psychology or work with a sex therapist to help. And I think the other thing is just to take your time about a lot of things. So it's maybe explaining to your partner, trying to get them to have a look at some of the online resources. There are some good resources for partners online. And I think it's worth, if you have an engaged partner, to ask them to have a little read and just to take their time with you and take a bit of the pressure off penetrative sex. Because I think if you can take the pressure off, sometimes everyone relaxes a little bit. And it can make the whole situation a lot better.
So one of the commonest questions that I've got asked since we've begun recording podcasts are, what do I do with myself at my clinics, apart from when I'm working as a GP in my GP clinic? So at my clinics that are called You by Dr Shauna Watts, the clinic is centered around you, and it's all about making everyone who comes, but that's mostly middle-aged women, feel more confident, and to help people navigate what I find is the overly complicated world of skincare. No one knows where to start, what's real, what's not, what's going to help, what's not. Various treatments in terms of wrinkles and skin laxity and skin tightening and pigmentation and discoloration and what they should have and whether it'll help them. So basically, my role in that is to create a bit of a plan and a journey for you to get you to the point where you're back feeling confident and healthy and happy in the skin you're in. The clinics are based on the Central Coast and in Newcastle, and we would love for you to come and visit us and have a no obligation consultation to see where that journey might take you.